Selam arkadaşlar.
Merhaba hocam.
Niye? 3 kişiyiz.
Daha 2 dakika var. Belki gelirler.
Ben şimdi buraya şeyle bağlanabildim. Passcode'la bağlanabildim. Bunun normal daha önceden olmuyordu. Böyle bir şeye ihtiyaç. Passcode'la bağlanabildim. Bir de live streaming başlatmışsınız galiba, öyle mi?
Evet hocam, başlattım.
Passcode'la bağlanabildim. Allah Allah, ben kendi sesimi duyuyorum. Niye?
Bir saniye. Sizin şu an YouTube açık olabilir mi arka planda? Bir saniye. Şu an duyuyor musunuz hala?
Şu an duymuyorum.
Heh, tamam.
Ben kendim konuşunca duyuyorum herhalde. Kulaklığım da var.
Şu an bir sorun olmaması lazım.
Tamamdır. Herkes passcode vererek mi girmeye başladı? Bu passcode'un gerekli olmaması lazım.
Çiğdem Hanım o şekilde paylaşmış şeyi. Passcode yani mailde olduğu için sorun olmaz herhalde. Girebilirler.
Evet, ben her halükarda geçen sefer de duyurulmuştu. Biz normal tek klikle giriyorduk. gene aynı şekilde bir serbestliğe doğru gitmemiz lazım herhalde. Bu şekilde Passcode'la da olur, sorun yok da.
Ha, bir dahaki
Artık,
haftalarda Passcode'da kaldırırız hocam.
eyvallah. Kim konuşuyor bana şu anda?
Evrim konuşuyor.
Okey, selam Evrim, ne haber?
Merhabalar.
Tamamdır Evrim. Yavaş yavaş millet damlamaya başladı. 2-3 dakika sonra başlayabiliriz herhalde. Şu anda live ediyorsunuz.
Evet, kayda
Ama
geçtik.
bu, yani mümkün olduğu kadar az editing gerekmesi için ben seminere başladığım anda kayda başlayın. Ki sonradan başını sonunu kesmek zorunda kalmayalım.
Tamam. Bu seferlik böyle olacak sanırım ama.
Kayda başlamış mıydım?
Evet.
Tamam, sıkıntı yok. O zaman bir şey yapmam gerekecek. Bir duyuru metni bulayım ben seminer için. 2 dakikaya dönüyorum. Gelenlere bir yazı yazın. 3 geçe başlıyoruz.
Tamamdır.
Thank you for all coming. Without further ado, let me start a quick presentation here. Usually this time is reserved for students to, second week is for student master's presentation. But we apparently moved that to the next week. So there was no assigned speaker for this week. So I'll give you a presentation. So let me see everybody's nice and beautiful faces, so I can take a nice picture for my social media campaign, I guess. So we will capture it for what is the favorite social media medium for this? Instagram. Let's put it on our Instagram page for this one. Nice smiley faces for Biomedical Engineering Institute. Like we are solving some of the major world problems or world hunger, something like that. Let's see. Okay, print screen. 1 second. I got everybody here. Documents. Documents, seminar, 2021. Okay. And let me capture one more time. Okay. Excellent. So now everybody can go back to sleep. I'm sorry, I'm just kidding. Now I'm going to give you a little bit introduction for especially newcomers. You had a nice introduction to the Institute. Now I will put you a little bit more framework as you are, some of you discussing and maybe academic life, others are probably asking themselves, what am I doing here? Why didn't I get a job or go to another country or some other stuff? It's a critical times. Let me give you a little bit broader perspective. Overall, what you can do at this institute and Bogazici University, and what is also within our research and innovation ecosystem beyond what you see at the Institute of Biomedical Engineering. So I am hoping that our administrator staff gave me sharing capabilities, right? You did, guys. Let's see. Evrim, are you alive?
Ne yapmak istiyorsunuz hocam?
Ekran paylaşımı.
Size izniniz yok.
Vallahi müsaade edersen. If you, I mean, he's the big boss. Evrim is the big boss. He has to give me permission to share presentation for me. Or you can make me a co-host or something, Evrim. Let's see.
Yaptım hocam.
Bir deniyorum. Excellent. Everybody started seeing something? A screen?
Yes.
Yes.
Excellent. So I'm going to talk a little bit about a disruptive medical technologies terminology. I gave this presentation a couple of years ago, also modified it on several occasions. So you can find the full presentation on the YouTube, even if I can share it probably with you guys. So I will give you a little bit broader pictures. Why do research? What is a worthwhile research and innovation? If you start your thesis and academic life, maybe these will be a little bit relevant to you. So I'm a faculty member here. I'm originally a medical doctor. As far as I know, I am the only medical doctor at the Bogazici University. I specialize in physiology. During the physiology, I decided to start a new adventure, got a scholarship, and went to a PhD program in biomedical engineering. I did all the engineering courses afterwards. So I'm in no position to give a career advice, I guess, because I essentially do back-to-back 2 careers, and it is nowhere can be replicated in any civilized world. But my research is in medical imaging, image-guided therapy. I worked on it several years here, and I continued to work here. But 14 years I worked in US at Drexel and Johns Hopkins universities mainly, and also later at NIH, National Institute of Health, on medical imaging related topics. I'm here for the last 20 plus years. I'm the founding director of the Center for Life Sciences and Technologies, which I will describe it a little bit briefly, which all, if it's up, infrastructure is available to you. I'm also currently coordinating its industrial projects, and I will explain that as well. For the last 10 years, I'm working on a university industry collaboration platform, which started in a separate project, now got a new life purpose direction as a regional health industry cluster, and that's a 5-year effort. So therefore, I am running around institute like a headless chicken most of the time. But if you want to ask a question anytime, just interrupt my rapid pace and just ask whatever you have in mind. So the students should come as first. Sometimes we will forget about it in our busy schedules, but we are here to essentially help you with your education as well as research, and also we should be available for any kind of guidance. Okay, I'm not talking about my research experiences here. This slide was shown last week as one of the slides describing our institute. My lab is also hidden at this campus. It is at the Feza Gürsey building where you guys eat. If you manage to find a restaurant on the campus, that building at the first floor, we have an X lab, which it is a medical imaging instrumentation laboratory, and we do X-ray related research. There is plenty of information on the web on that. We have an X-ray system working there, working on hardware, software component. We try to make the panel now, and a new student even tries to make some nuclear instrumentation imaging system, gamma scanner, portable gamma scanner. We get funding, have students, and usually we have long-term and difficult projects on that. But if any interested people work in electronics, mechanical engineering, or have software information, could step forward and find me in a separate time. So our topic is disruptive technologies in health sciences. What is that? Disruptive of what? Disruptive what is available on the publication, disruptive in the funding distribution. What are we disruptive of? If you are a clinical focus, you have a particular disease, now you find an out-of-box solution for that disease, unconventional, beyond going conventional approach of disease treatment. Do you want to change the way we carry healthcare in this country or in the world, regionally, anything? You want to change the biggest players in the health economy, the big companies? You want to have a new way of disruptive economical outlook, or you want to change the overall framework of how we look at the health or life in general? I mean, the last one is a philosophical topic. So the first two I'm not interested. With the last three, we will gonna focus a little bit more in this brief seminar, which we're probably gonna have to finish within the next 15, 20 minutes. So what parameters do you think we use the potential value of a disruptive technology in health sciences? Does it technically, technologically, scientifically beyond the state of the art? The first question that we ask. Does it increase the quality of life of the patient? Sometimes we only focus on a hammer, but we do not actually extend the quality of life. The 30–40% of the healthcare expenditure in a developed country is end-of-life expenditure. Intensive care units, just to extend the quote-unquote life, but the quality of life, but it matters. Do we simplify the diagnosis and management of a particular disease is the critical point. Things are getting more and more complicated these days. So when you do a certain contribution to the biomedical engineering, it's a good idea whether you cut the complications and simplify a certain diagnosis or management procedure. Even if there is a new terminology that we also accept it within our lab, is the democratization of a certain research field, meaning that you are not restricted to a certain device extensions. You are doing open research in collaboration with other partners. Everybody is contributing to the hardware and software development. Eventually, you want to develop devices which are then economically affordable by a wider community of people in the planet. And considering that, we also always be in considering the cost these days. Money is scarce. Does it save the money? Is it going to be made accessible to all? Who's paying for it? Some of the things that are very hot these days, not all of them are relevant to biomedical engineering, but it should be within the scope of anybody who's doing a graduate work in biomedical engineering or health technologies. Is some of the things that I'm going to throw at you is very, very hot these days. And these are definitely disruptive. Immunometabolism and immunotherapy. This is going to change all the cancer therapy. It's going to change nuclear therapy. It is a new way of looking at how we treat certain diseases, starting with cancer, maybe going to the neurodegenerative diseases, beyond what we think. Cellular therapy, you guys have been following these very closely, utilizing your own cells or compatible cells coming from a bank to treat diseases, including these cases for cancer. So stem cells, gene editing, synthetic biology, bioprinting, all these things, lots of bio. So you are at a career in biomedical engineering now. Did you choose a wrong field, or is something that you can be in this active disruptive technologies much needed in our country and in the world as a biomedical engineers? But principally, we need also lots of devices in biotechnology, right? Medical devices are used for any biotechnology-based solutions and cell-based therapies. Cell specialization in conditioning, cell filtration and separation. Many devices are used for stem cells and regenerative medicine application in terms of generating and conditioning these cells. Point of care technologies currently are utilized for only diagnosis and Internet of Things, but it is also utilized now in biotechnology field as well. So whatever you do, when you're developing a solution, or you want to be a part of the solution, not the current problem or of health technology, you have always start from what is the unmet clinical need, and also whether there is an actively bleeding financial burden to the society or to the people that have to pay it out of pocket, right? So this is something that we always have to focus. Also, you need to focus what is the big picture in the world. So You can always think that, okay, if I'm going to spend 4, 5, 6, 7 years for a PhD here, if maybe I can also look whether I'm actually part of the solution of the global challenges, specifically global health challenges. Not everybody has to do it. Diving into vertical scientific focus is also fun and needed as a basic science. Is much more much work needs to be done in our national scale and global scale here as well. But from a biomedical engineering, translational, application-oriented guy, these are our global health challenges: aging, chronic non-communicable diseases, right? Non-communicable. So not like current pandemic. It is more like diabetes, right? Lifestyle diseases, psychiatric diseases. Of course, coming back to the pandemics, antibiotic resistance, bacterial infection, viral infection will be an increasing problem with the climate change and increasing mobility. And there is still gaps in the sanitation and healthcare delivery in large sections of the world, in rural areas, in underdeveloped countries. So, for example, aging is a new challenges. People think that aging is a disease. Some big pocket guys started research activities, institutes, and funds whether the aging could be cured, right? For looking at the non-communicable diseases, diabetes, cardiovascular diseases, respiratory diseases, neurodegenerative diseases will be the main cause of the diseases that gonna kill you. Also, the guys that are watching the seminar will be killed in one of these diseases or cancer. That will be the 80–90% of these cause of the death. So you wanna do something matters, global challenges. You wanna eliminate, extend life, eliminate that something is killing you. So you can also look at not only you wanna contribute on a disruptive technology, bringing a new angle to all problems, but you can even have a disruptive platform technology, which could contribute to many things at the same time. So if you are focusing on the medical devices, for what will be hot and relevant on the future, devices, systems used for minimally invasive surgery or image-guided medical intervention. As you can know, we have a dedicated clean room at the top floor. You can certainly do as far as your heart desires and your imagination tells you to go in terms of this kind of intervention, because we have a specific infrastructure at our institute supported by the Life Science Center to develop smart in vivo medical devices. Some of them are here, shown here. You can continue with the implants on cardiovascular implant, neuroprosthesis, very, very hot. I'm going to come back to this topic. Interfacing these neural tissues with implantable chips, brain-computer interfaces. These are getting to be on the main list. Everything is going to be mobile in the future. So taking connection of these Internet of Things, high-speed bandwidth internet connection, going to the 5G and beyond, you can think of a scenario where the healthcare is more embedded to daily life. So you can certainly try to focus on that, develop your ICT technology as well as your computing knowledge, then we'll start medical device, try to follow up the diseases, chronic diseases, cardiovascular diseases, such. So this will be then the health technology or staying healthy, chronic disease management will be not done in big hospitals as we are trying to do in this country, big, large hospital, which might be very suitable for additional purposes. But the future tells us that in the next 10, 20 years, most of the things will be, your disease will be maintained, diagnosed, managed as you go through your routine life in smart city, in smart home, while you are walking, shopping or going through your vehicle. So certainly you have somewhere to go. So bottom line is, I give you a large picture here, go through and look at the big picture. Before you jump into something, before you do something, some academic advisor like myself is recommending you to do, look at the big picture. Where are we in Turkey and what do we need to do? We are in not a good spot. Or there is like 85 to 15 ratio between your export and import. Of course, export is more. In a $2.5 billion medical device company, we are doing horribly in biotechnology field. We are rapidly aging and we are gonna spend more and more money on healthcare. We cannot maintain this $400 per person health expenditure anymore. So our government is very motivated. Industry is developing. Infrastructures like at our institute is bad, but currently we are in trouble. Medical devices is second largest source of national debt. And the problem is getting better, bigger and bigger every year. So we need solutions, researchers, young entrepreneurs, some kind of solutions again. So we definitely need solutions. So what you will be exposed to while you are doing your academic life and education, if you open your eyes and see what's happening around you, is like the Istanbul Health Industry Cluster. Is essentially cluster is research institute, academicians, all the related members working on a common goal and building a local economy in a specific industrial topic, which is medical devices. Many companies are here, many universities support this initiative, as well as several NGOs. You can get more detailed information in the cluster's webpage. The idea is not an academic research here, but from an idea, whether you can find a commercial entrepreneur activity at the end. It is a 3-4 year process, and the cluster wants to encourage, support these type of innovative activities at every level. So this cluster is industrial entrepreneurship, has to have nice coordination, firm footing within the university, and Bogazici University Center for Life Sciences Technologies, a 10-year process for which the clean room is a part of. In the new building, there are additional labs, is trying to be also not only doing research for the research sake, basic science research in medical devices and biotechnology and molecular biology, but also tries to assist with university industry projects and provide services for people who are trying to do entrepreneurial activity. So currently more than 40 academicians support this center and many students are here. The animal facilities that you can have easily access to are in the main campus, North Campus, where we also animal breeding is happening there, with including some transgenic and skid animals, all accredited nationally and internationally. There are many test and analysis labs distributed, owned and operated by the center, which is also some of it, most of it are in the other campus, North Campus, but some of it will be moving more and more towards the new glass building of this campus. And the clean room is focused on in vivo medical devices. We have metal plastic operating facilities. Here also develop devices that will stay in the body short and long term, catheters, stimulators, and that kind of stuff. So whatever you want to envision in a device, we can probably process it on electrical field. So a few things about the new Kandilli Science and Technology Complex, which has been also a dream maybe at least 7-8 years. Now it is coming to a reality. Some delays to the pandemic are inevitable, but what is available to you is this new building, which is now, sorry for the slides, will be mainly, I'm thinking in Turkish because I didn't have time to translate it, but I translated on the spot. So this new building is a Bogazici University Kandilli campus, essentially science and technology building, but we will name it as at Bogazici University Kandilli Deep Tech station, I guess. That building is not connected to any academic unit, but Center for Life Sciences and Technology, Biomedical Engineering Institute, Chemistry, Physics, and Chemical Engineering people, labs are currently started to get going here. Some of your thesis work might be actually in the labs in the new building. If your faculty advisor has an assigned place at designated space lab for him, or you can certainly utilize the facilities of Center for Life Sciences and Technologies. There is a conference center, meeting rooms, additional classrooms are there, and there's a graduate room on campus, and you know the rest. So there are some meetings started happening at the Deep Tech Institute. So if you are not, you didn't get the notice, it is our fault yet. Send me an email. I will make sure that you get it directly. Usually we send it indirectly through the institute, but it is always to be in the direct mailing list. So, for example, this was done for the investment things. If you go to the main building, which I encourage you to do, it just roam freely. There are many interesting aspects of the new building. There is the life sciences entrance. Of course, the TTO and the incubator and the accelerator programs will be housed at the special section when you enter it on the left side. I'm currently there, actually broadcasting from that location. With new activities will be immediately accessible to you. So if you are going to start sending a technogrammaton, if you want to consider part of your academic work in the future or in parallel an entrepreneurial activity, make sure you first all on agreement, in full agreement with your advisor. I cannot stress this enough. Okay, if your advisor approves, then also you can have immediately accessible to you an entrepreneurship support. It doesn't have to be a success, but you can get certain experience, be part of the other activities, volunteer, can work at the incubator center, accelerator center. So all hands could be on deck in the new building. This is the Center for Life Sciences and Technologies. It is part of the overall picture of it. Its focus is targeted therapy technologies. Lots of center activities are given here, all doing basic science, including commercialization. And this is from another one, pictures. The thing that I'm gonna focusing on, remember the things that I mattered and hot and disruptive. The center builds the infrastructure for that, actually. If you want to work on immunotherapy or nanomedicine or biotechnological technologies, the center is providing the basic infrastructure for that, like that accredited animal facilities to do cancer research or biotechnological research like vaccine and such. For example, the cancer therapy is gonna be a problem here in Turkey as well, with the aging population and some of these. For example, you mentioned, you might see in the news, there has been vaccine development happening with our Nesin Hoca from the molecular biology there. Rana Hoca from chemical engineering, I'm sorry, he will put red pepper in my mouth. From chemistry department, he is doing nanomedicine targeted therapy. He's got the biggest biotechnological venture fund support for his academic startup firm. and currently doing his research, basic research at the center. And he will be coming back and forth a lot to the new building as well. Another important topic is neurodegenerative diseases with the aging population. And within our institute, we know we are working a lot of people on biomaterials, which can be applied for neurodegenerative diseases, neuroprosthetic development, neurophysiology, neuroimaging, right? All these are within our team, and a significant students enter these labs coordinated way. Within all these activity and the new building, we will have an MRI and PET-CT imaging, medical imaging devices will be set up in couple of months. So next year, you will be able to utilize that. I mean, knock on wood, if nothing prevents that. We will have the, so you can dream big and develop imaging projects which involve preclinical animal imaging, following certain animals over time, chronically. Or we have also a new SEM device, very popular in materials field, the first of its kind, environmental colored SEM, they say. I am no expert in that, but I'm told this is the best SEM for biological materials. Will be operational in a couple of months in the new building for projects. So if you are somehow experienced in that, come to us. This is the SAM. Additional industrial labs will be there. There will be second floor, will be animal housing facility, and imaging facilities will be there with PET-CT imaging. Lots of laboratory areas, biomaterials imaging areas like that. We are involved in several large-scale international projects as an institute. So one of them is in neuro, iNavigate, and Neurotech EU is something you should personally follow, because this will allow you to quickly jumpstart travel among very different universities while you are affiliated at Bogazici University at the institute. Since they are already connected, it will be a much easier acceptance and transfer capabilities. 2 large-scale international grants are being conducted. I am conducting the first one on the left, and there is also a second one is happening at the Sarıtepe campus. It is with Chemical Environmental Institute. The left one is the ones that are giving you this animal imaging facility and such. And this is also a large scale, and this one is the algae bioproduction plant, which they are having also many interesting biotechnology laboratories at the Sarıtepe campus. Is also doing this under the umbrella of Center for Life Sciences and Technologies. So many academic startups have started from researchers, doctors, and also or graduates of PhD students or master's students have started several startups as well, and we'll try to encourage that. Try to find a solution to our current active problems that are happening inside there. And we also have, for people, if you have a startup company and such, a Center for Life Sciences, we have also a strategic partnership with Regional Technopark as well as with Technopark Istanbul, which is next to the Sabiha Gökçen Airport, and the cluster has operations there, so you can go and back and forth and utilize those infrastructure in a perfect way. So look at the full ecosystem. So there is a center accessible to you. The centers, the cluster network is available to you. Many hospitals are easily accessible to you. So this was the focus of this presentation. So some wise words to students and young researchers. So you can do more relevant and ambitious projects. Or infrastructure is good or excellent and also improved. So all of these is available to you. So don't keep yourself restricted in your comfort zone, in your lab, even with your advisor, right? All neighboring labs, lifestyle labs, other labs in our university, also other universities through the cluster and additional collaboration and international affiliations is available to you. So there is not much an effort making a difference between two projects. One that just adequate for graduation, getting the Bogazici, I guess, diploma, or aiming for relevant goals within some of the specs that I described here. Can you want a project? How about your own startup? You want to start entrepreneurship? Okay, you can protect your ideas. The TTO is here, will be operational in the glass building. We are here as a cluster here. Make sure you are open with your advisors. So there are many supports available to you. There is two big programs, these technogration programs will be actually physically conducted in this campus, right? In the new building. So it's a good idea to consider that. And there's application going on right now. So there's lots of additional activity going on here. Different effort is needed. Make sure to think it twice, especially for PhD students. If you want to combine it, entrepreneurship activity with the academic activity, it will certainly delay your graduation. Make sure you are not one of those people who are constantly seeking awards and anything. Make sure you produce something, a solution at the end. So 3 things will move you forward. Things you read, printed and online, like the things here. Things you do, you have to do projects, keep yourself busy, and people you meet. So come and meet the people around you in the new building, in the cluster, and within the network that we have all nicely set up for you. So that those things will you move. I'm sorry, people you meet. So, I mean, my last word doesn't seem to end. Sorry about that. So I guess classical stuff, motivational talks, cooperation and teamwork. I cannot stress this more. One person can do the thesis, but a team is needed to make a difference. So there could be difficulties, but have fun in this long journey. And this is my contact information. As I said, I'm gonna stop these here, and certainly you can find this everywhere, also on the web. I do these talks with several flavors on several occasions, and I managed this. I think we managed to save this as a video as well. But if there are any questions now, I can entertain them. I'm sorry I took a little bit longer than I expected, but this was the things that I usually find an occasion to do it at least once a year to all of our students. Okay, are there any questions? For people who are only waiting here to be counted as a seminar attendance could quickly disappear. The rest of you guys can freely ask questions for the next 45 seconds. Sorry. Okay. No questions? But what this academicians talking about is the faces that I see. Okay, why don't you sit on it, think about it, come find me if you have something you want to do, but you are not quite sure to do it in this environment, or whether you need to find your path to navigate through all these infrastructures that is available to you. When you are designing, you find a little bit lost on your academic goals, come to talk to us, me or any faculty member or any senior student or our graduates. That's, I guess, will be my final sentence. Usually there I expect more interaction, but I guess everybody is so overwhelmed by my wonderful presentation and seminar. They are just trying to digest it, I guess. Anywho, okay, if you are If you have any questions, funnels, and meetings, come find me. I'm at either institute or at the new building trying to get things operational. Ciao, ciao. Bye-bye. Thank you for the
Bye-bye.
for the technical support. Bye-bye.